Good morning, ma'am. So, I'm Anjik P. Kurba, and I'm from BSN 1A. So, I will demonstrate the assessing of the eye. So, first, we need to introduce ourselves to the patient. So, good morning, ma'am. So, I'm Anjik P. Kurba, and I will be your student nurse for today. So, I will be the one who will assess you on your eye. So, can you please state your name, ma'am?
Jaika Heartbeat Xiao,
So, how old are you po?
10,
Okay po. So, when is your birthday?
June 2, 2011.
So the purpose of this, ma'am, is for us to be able to see or observe if there are any abnormalities in your eye, and also if there are, mabigyan ng immediate care agad. So next is we're going to provide the patients with the privacy. So if the door is open, we're going to close it. So it's already closed. So also the curtain in window, if it is open, we're going to close it. Next, we need to perform a hand hygiene. After that is we're going to gather all the equipments that we will be needing. So I have here a gloves, a opaque card, a handheld card. So let's just pretend that I have a ophthalmoscope because I don't have that kind of equipment. So improvise. Also pen light because I don't have a pen light. And also the Snellen chart. So the Snellen chart is already posted in the wall. So next we're going to prepare or assess the client to a comfortable position. So if the patient is already in a comfortable position. So next, we're going to assess the patient with the collecting of subjective data. So I just have some few questions to ask po, ma'am. So I hope you can cooperate with me. Is there any changes of vision po, ma'am?
No,
Do you experience blind spots?
no,
Do you see spots or floaters?
no,
Wala naman po. So do you have trouble seeing at night?
no,
Do you have any eye pain?
no,
Wala naman po. So do you have experienced excessive watering or tearing
No.
from the eye?
no,
Have you ever had surgery?
no,
Operahan na po kayo? Hindi pa na.
no,
So do you have prescription for connective lenses?
no,
So have you ever been tested for glaucoma?
no.
So sa lifestyle nyo po, ma'am, ano po yung ginagawa nyo?
Nag-aaral po ng module
Module po yung ginagawa nyo. Ay, hindi naman po kayo nagbababad sa
dito.
gadget. Okay. So we are done with the collecting of subjective data. So next, we're going to assess the patient, or we're going to collect the subjective data or the physical examination to the patient. So first thing we're going to assess is we're going to test the patient with a distant visual acuity. So using the Snellen chart, so it's already posted. So we're going to ask the patient to stand. Ma'am, can you please stand po? So can you please come here, the front po. Okay po. Okay. So position the client 20 feet away from the Snellen chart. So I want you po, ma'am, to read what is written in the Snellen chart. So can you please read po, ma'am?
E, F, E, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, D, E, F, P, O, T, E, C.
Okay, so okay naman yung visual acuity niya sa malayuan. So nabasa naman niya lahat. So ma'am, can you please sit down po? So next, we're going to assess the patient with the near visual acuity. So we're going to use a handheld card. So using this handheld card, so ask the patient to read what is written in the handheld card. So do you use any contact lenses, ma'am?
No,
Eyeglasses? Nasumusot po kayo ng salamin?
no.
So can you please read this for me po?
God is always with us. Thank you, Jesus.
So, Next is we're going to assess the patient with the visual field or gross peripheral vision. So, I'm going to place my fingers to, in this area, ma'am. So, just look straight at me po. Opo.
Opo.
So, tell me whenever you see my fingers. So, tell me po if nakikita nyo. So, you can say yes or no. So, I'm going to assess you po or perform the visual field. So, tell me po if nakikita nyo.
No. Yes. No. Yes. No. Yes. No. Yes.
Okay. So, we are done with the assessing of the visual fields. Next, we're going to assess the patient with the corneal light reflex. So, using this pen light, so let's just pretend that this is a pen light. So, I'm going to spot the patient's eye. So, I'm going to spot your eye po with this pen light. So, just look straight at me po. Okay po? So, observe for any abnormalities. So, observe for any abnormalities that we can see to the patient's eye, and also symmetric naman yung pupil niya, and also round naman. Also, medyo ma-yellow yung iris, but it is normal sa eye ng patient. So next, we're going to assess the patient with the cover test. So using this card, we're going to ask the patients to cover one of your eye. So I want you po ma'am to cover one of your eye. Right eye muna po. Okay po. So I want you po to look straight at my finger, and also I want you to follow my finger whenever it goes. So this test is for the eye movement. So reactive naman yung eye niya. Yung kabila naman po ma'am. Reactive naman yung eye niya sa movement. Okay po. So next is we're going to assess the patient with the cardinal fields of gaze test. So, I want you po ma'am to look straight at me. So, while holding my finger like this. Okay po. So, just look straight at my finger whenever it goes. So, sundan nyo po ito kung saan pupunta. Okay po. Without moving your head. So, wag nyo pong galawin yung head niya. So, sundan nyo po ito. So we are done with the assessment or the test. So now is we're going to inspect and palpate for the external eye structure. So first is we're going to inspect for the eyelids and eyelashes of the patient. So ma'am, check ko lang po yung eyelids nyo and eyelashes. Check for any swelling, tenderness, and also the color. So next we're going to check for the or inspect and palpate for the bulbar, conjunctiva, and sclera. So we're going to use a glove. And also the left hand naman. So it is important for us to use a glove for us to avoid contamination from the patient or to the patient. So we're going to inspect for the bulbar conjunctiva and sclera. So ma'am, I'm going to inspect for the bulbar conjunctiva and sclera. So pwede pong tas niyo po yung mata niyo. So inspect for the bulbar conjunctiva and sclera. So check for any swelling, the color. Check for any abnormalities to the patient's conjunctiva and sclera. So next, we're going to check for the palpebral conjunctiva. So ma'am, touch ko lang po yung conjunctiva nyo. So I'm just going to inspect your conjunctiva and also palpate for any tenderness. Check for any swelling, the color. So next, we're going to assess and inspect or palpate with the patient's lacrimal apparatus. So check for any tenderness. So we are done with the inspection for the conjunctiva, sclera, and the bulbar, and also the palpebral. So I'm going to dispose the gloves that I've used. So next, we're going to check the patients or inspect the patient for the cornea and lens. So ma'am, tingin na po sa akin. So check for the cornea and lens. Check for any abnormalities. So normal naman yung cornea niya and lens. So check for the iris and pupil. So ma'am, look straight at me po. So round naman and symmetric naman, and also the iris medyo yellow siya. Check for any abnormalities that you can observe to the patient's eye. Okay. So next, we're going to assess for the patient's pupillary reaction to light. So I'm going to turn off the light. So I'm going to use a just pretend that this is a pen light. So I'm going to assess the patients with the reaction or pupillary reaction to light. So I'm going to turn off the light. So I'm going to use this. So ma'am, I'm going to spot your eye po. So focus ka lang po ma'am dito sa finger ko. So normally, pupil constrict. So reactive naman siya sa light. Okay po. Oh, sorry for that. So next, we're going to assess the patient with the accommodation of pupil. So, I want you po ma'am to look straight at this object. Opo, sundan nyo po ito without moving your head or without unnecessary movements po. Okay po. So, I'm going to hold this object like this. So, sundan nyo lang po siya. Okay po. So the patient is reactive to light. So next, we're going to inspect for the internal eye. So let's just pretend that this is a ophthalmoscope. So we're going to check for the internal eye. So ma'am, look straight lang po. We're going to check for the retinal vessels in the retinal background. Check for any abnormalities. Also, we're going to check for the fovea, the surface area of vision, and also the macula, and the anterior chamber. So next, we're going to assess the patient with the eye trauma. So I don't see any abnormalities from the patient's eye. So usually a person with a person with a eye trauma has a pain and discomfort. So I don't see any bloody sa kanyang eye, and also I don't see any abnormalities. So after that, if we are done with the assessments, we're going to document all the data that we've gathered. So document all the data that we've gathered. So if ano yung ginawa natin, so if may nakita tayong abnormalities sa patient's eye, we're going to document it. And also if what is the procedure that we do. So we are done with documentation. So after care, gather the equipments that we've used. Then after care to the patient. So we are done with the return demonstration for the assessing of the eye. So thank you.